Hello, my name is Dr. Bob Demir with another get to know video for you. And today, we're going to talk about your numbers. You say, what numbers are you talking about, Dr. Bob? I'm going to talk about numbers that really are going to impact your health long term. The very first one is your cholesterol level. You want your cholesterol level to be at 200. If it's higher than 200, like let's say 250, I know you're eating too many sweets. That's right. When it's up to 300, I know that most of your diet has to do with sugar and trans fat. Both of those cause inflammation. And see what the cholesterol is doing? The cholesterol is literally lowering the fire inside of your body. So cholesterol is very important to me. If your LDL cholesterol is elevated, I know your body's inflamed. The number one item I see to help lower cholesterol is minimize your sugar. And of course you could do Dr. Bob's ABCs, a half a red apple every day, third cup of beets, 4 or 5 baby carrots, or 1 medium carrot. You can lower your cholesterol up to 40% just by eating 15 grams of beet fiber. But I want to talk to you about another number that you might not be familiar with. It's called the HA1C. HA1C is the amount of glucose that's on a blood cell. And it really gives us a real idea of what's been going on with your blood sugar the last 3 months, because a blood cell lives about 120 days. You know what? When I turned 55 years old, if I did not pass my HA1C, I self-pay my own health insurance, I was gonna have to pay $250 a month. Between myself and my wife, Debbie, we're gonna be paying almost $6,000 a year extra in health insurance. So here's what's going on. You want to make sure that your HA1C is within the normal range of your lab. That means you want to cut back on sugar. That's right, even cut back on fruits. You want to make sure you're eating enough protein. I really focus on eating green vegetables every day. I stay away from fruits. I only eat a half an apple on a regular basis. So, cholesterol under 200. HA1C, you want to be within the normal of your lab. Here's another number for you. It's called your lung age number. See, in our practice right now, we're using a spirometer to tell us how much a person's vital capacity is. That's the amount of air that blows out through their lungs. What's really interesting about the spirometer, I can learn your lung age. If you're listening to me or watching me right now and you smoke, I've had patients come into our office that were 24 years old but had the lung age of over 100. But here's the major concern, what I've seen in our own practice. We're having individuals come in and they're concerned because they're going to have COPD because their mom or their dad had COPD. You say, Dr. Bob, what is COPD? It's chronic obstructive pulmonary disease. And I know it's a big term, but it's going to be what's happening in our society today because everybody is starting to crunch forward. When you crunch forward, your lungs compress and you have less oxygenation. So a spirometer, you want to find a healthcare provider that can do a breathing test for you to find out your lung age. I have mine done on a regular basis. I can tell you this, my lung age is in the 40s. That's tremendous. Here's another number for you. How much does your head weigh? You say, Dr. Bob, who cares how much my head weighs? Well, I care because this is what we're learning. The average head weighs about 10 or 12 pounds. 10 or 12 pounds, about the size of a bowling ball or the weight of a bowling ball. For every inch that your head goes forward, it increases the weight of your head 10 or 12 pounds. Why is that a concern? Because I know that many of you have smartphones and you're looking at your computers and you're looking at your tablets, and all day long your head is forward and it's more forward. What happens then, you start to get carpal tunnel syndrome. Your breathing's compressed, you have fatigue, head pain, pain between your shoulder blades. I can go on with it. It's because your head is in a forward position. Well, we have the ability, and I know you could find a healthcare provider, you could even go and get your own app and take a picture of yourself from a front view and a side view to find out how much your head weighs. So what are you going to do about it? If your head weighs 30, 40, or 50 pounds, I want you to get a large ball, an exercise ball, and start laying backwards on it like that, 3 to 5 minutes every day. This is critically important for your long-term health because you want to make sure that you have adequate vital capacity for your lungs. Here's another number for you. It's your BMI, your body mass index. It's your weight and your height. You want your number to be less than 25 because that's normal. When your BMI is between 25 and 30, you're overweight. And this is serious today because I can forecast what's going to happen to you in the future is that we're going to be having increased health benefit cost sharing. Say, what do you mean, Dr. Bob? Well, we're seeing in our practice, individuals who do not have a normal BMI have to pay more for their health insurance because it's called pay to play. If you're not healthy, you're going to be paying more for your own health benefits. So your BMI is a very common number that they use, the health insurance companies use, to make sure that you're doing your part. So we have cholesterol. 200 is a great number. Your head weight, 10 or 12 pounds. Your HA1C should be within your lab normal. And then I want to make sure that you know how you can keep your cholesterol under control. Stay away from sugar. I know you're going to want to watch this video over and over again because these are really important numbers. My name is Dr. Bob DeMaria.